Thank you for inviting me to Erde, Transylvania, Romania. I had the pleasure of being in Cluj, Kolozsvár last, I think it was September. I don't remember anymore. And I'll be back in Bucharest in this fall. It's always a pleasure to visit your country. I know that this is a technical conference, and the audience is mostly people involved in technology. It's not a health conference, but I was asked to speak to you about health. And what's interesting for me as a medical doctor is that we have these wonderful advances in medicine, amazing, miraculous achievements that modern medical science has attained. But at the same time, the number of people with chronic illness is going up. And the number of people with autoimmune diseases, where the immune system attacks the body, is going up. Number of people with mental health conditions like anxiety and depression and attention problems, addiction problems is going up internationally. And Western medicine, although it's, again, amazing what it can do in terms of acute problems, is very poor at healing or even understanding chronic problems. And so what I'll be presenting you today is my understanding of what's behind chronic health issues of the mind and the body. What is it that medical practice doesn't recognize, and some possible ways of understanding yourselves so you can look after your own health. So my background, for those of you that don't know it, I was born in Budapest in 1944. We left Hungary after the revolution of 1956, emigrated to Canada, and I became a medical doctor. And for 20 years or 22 years, I was a family practitioner, a family doctor, looking after people from birth. I delivered babies and looked after old people. And for 7 years, I also worked in palliative care, which means I was working with people who were dying of chronic illness and cancer. And then for 12 years, I worked in a place here in Vancouver, British Columbia, Canada, called the Downtown East Side, which is North America's, in fact, the Western world's most concentrated area of drug use. So in a few square blocks, we have more people using drugs, cocaine, crystal meth, opiates, heroin, codeine, fentanyl, than any other area of the Western world. It's really a shocking place to visit. So I worked there for 12 years. Now, the Western medical ideology in which I was trained basically separates the mind from the body, so that it doesn't recognize that emotions and people's psychology has a huge impact on people's physiology. So when you go to a doctor, most likely they're going to look at the physical issues. Let's say you go in with an inflamed joint, an inflamed elbow or fingers because of rheumatoid arthritis. Or let's say you go to a doctor with paralysis or numbness in your hand because of multiple sclerosis, or with intestinal problems because of inflammation in your guts, or skin problems because of inflammation in your skin, or lung problems because of asthma, inflammation, and narrowing of the airways, chronic fatigue, fibromyalgia, which is a painful condition of the whole body, or you go in with anxiety or depression or problems focusing, attention deficit problems. Usually, they're going to look at the symptoms, but they're not going to look at the causes, because they understand the causes to be simply biological. So that if you're depressed, there's something wrong with your brain. Or if you have attention problems, maybe you have a genetic problem in your brain. if you have rheumatoid arthritis, inflammation of your joints, it's a physical problem. So they'll give you the physical treatment in the form of pills or surgery. In the case of depression, they'll give you pills. In case of anxiety, they might give you pills. ADHD, attention deficit problems, they might give you pills. In the case of physical problems, they'll give you pills. And I'm not saying that that's necessarily a bad thing. Those pills, medications can be helpful, but they only deal with symptoms. They don't deal with underlying problems. And what I began to notice in family practice, and as a family doctor, I had an advantage over my specialist colleagues in that I knew my patients before they got sick. When you go to a specialist, you're already sick. They don't know you as a person. They don't know your family background, your personal history. They don't know your personality. They just see you walking in with a symptom or a disease. Whereas as a family physician, I got to know families and I got to know people's history and their personalities. And the same thing when I was working in palliative care, working with dying people. When you sit down with people who are dying and you sit by their bed and you really listen to them, you learn a lot if you listen. Now, let me tell you something interesting. About 12 years ago, and this is kind of the theme of what I'll be talking about today. About 12 years ago, a nurse in Australia wrote a book, and she was a palliative care nurse. Like me, she worked with dying people. Now, these are people who were dying before their time. So they were not old people, but they were people, in their 50s, 60s, even younger, dying of cancer or some chronic health condition. And she wrote a book called The Top 5 Regrets of Dying People. So what is it that dying people most regretted, most felt bad about in their lives? You know what the number one regret was? The number one regret of dying people, and I found the same thing, was that they were afraid to be themselves because all their lives they tried to please or impress or be accepted by other people. So they never really lived their own lives. They never really expressed who they were. And among the other 4 top regrets was that they didn't express their feelings for fear of alienating or somehow disturbing other people. Now, let me tell you something about the expression of feelings. There was a study done in the United States, maybe about 20 years ago now. They looked at 2,000 women over a 10-year period. In that 10-year period, they found that women who were unhappily married and did not express their feelings were 4 times as likely to die as those women who were unhappily married and did express their feelings. Now, what does that tell us? It tells us that there's a huge connection between our emotions and our expression and experience of emotions and our physical health. And let me tell you something very interesting. There was a very famous doctor from Transylvania, Hungarian speaking, about Hungarian and Romanian speaking physician from Transylvania. His name was Soma Weiss, and he taught at Harvard University. He was so famous. He died in the 1940s. He died quite young, but he was so famous and so respected that at Harvard University Medical School, to this day, they have a day in his honor. They have a research day, a Soma Weiss Research Day, named after this Romanian physician, Transylvanian physician. And Soma Weiss gave a lecture in 1939 to the medical school class, the medical class at Harvard University. And this lecture was published in 1940 in the Journal of the American Medical Association. And Soma Weiss said that emotional and psychological factors are as important in the causation of physical illness as physiological factors, and they have to be at least as important in the treatment. Now, he said this in 1939. What's interesting at Harvard is that they have a day in his honor as a physiologist and a researcher, but they completely ignore his teachings. So they still don't talk about mind-body health at Harvard, or they're just beginning to. And this is despite the fact that in the, 84 years since he made that statement, there's been all kinds of medical research proving how right he was. So what I'll be talking to today is I'll be giving you a different view. I'll be giving you a view that has been called biopsychosocial, which means that the biology of human beings is inseparable from their psychology and from their social relationships. Now, let me give you a couple of examples. There was a study that came out of Harvard University 5 years ago. It showed that women with severe post-traumatic stress disorder had double the risk of ovarian cancer. So the more severe the symptoms of stress were, the more likely they had to have cancer of the ovaries. The milder the symptoms, the less likely they were to have ovarian cancer. Let me tell you some other studies. It's been known for decades, that children whose parents are stressed are much more likely to have asthma. So that the more stressed the parents are, the more likely are the lungs of the child to be inflamed and the airways to be narrowed, which is what happens in asthma. It's been shown in the United States that the more episodes of racism a Black woman experiences, the greater her risk for asthma. So there's something that connects emotional and social stress to inflammation of the airways, because the mind and the body can't be separated. This is not new. In 1870, the French doctor who first described multiple sclerosis, his name is Jean-Martin Charcot, he said that this is a disease caused by stress. In 1870, a British surgeon, James Paget, very famous to this day, said that breast cancer in women was linked to emotional factors. In 1896, a very famous Canadian doctor, one of the great medical teachers of all time, Sir William Osler, said that rheumatoid arthritis was caused by stress. When these pioneers made these observations, they didn't have the science. We now have the science proving the connection between stress and trauma and physical illness. But doctors still are not taught that information. So let me tell you what I learned, what I saw in family practice. So I'm going to give you, I'm going to read you some newspaper articles illustrating what I found in family practice, that who got sick and who didn't get sick wasn't accidental. That there are certain features of the personality that kept showing up in people with chronic illness. So I'll read you the first one. This is all from a Canadian newspaper. This is the biggest or the most prestigious newspaper in Canada. It's called the Globe and Mail. In the 1980s, I used to write a medical column for them. And this is from an article written by a woman who's diagnosed with breast cancer. And she describes her visit to the doctor where she's given a diagnosis. Now, she's married to a man whose first wife died of breast cancer, and now she is diagnosed with breast cancer too. So this is her words. I'm going to read you now. The doctor tells me that the lump is very small, most assuredly not in my lymph nodes, unlike that of my husband's first wife, whose cancer had spread everywhere by the time they found it. You're not going to die, the doctor reassures me, but I'm worried about my husband, I say. I won't have the strength to support him. Now, what do you notice there? What's wrong with this picture? Raise your hand if you see anything funny about this, anything strange about this. Yeah. She's the one diagnosed with a potentially fatal illness. And her first thought is, and she's the one that's going to have surgery, maybe radiation, maybe chemotherapy. And what is his first thought? Her first thought is, how will I support my husband? So this compulsive and automatic regard for the emotional needs of others while ignoring your own is a major risk factor for illness, for reasons I will explain. The other articles I'll read you, just 3 more, are obituaries. And obituaries are very interesting because in the obituary, they always talk about how nice this person was. And they praise them for characteristics that I think contributed to killing them. There's an expression in English. I don't know if you have it I don't think I know it in Hungarian, and I don't know if you have it in Romanian, but in English, they say, the good die young. And often they do. There's a reason for it. So I'm going to read you an obituary now. This is a doctor who died at age 55 of cancer in Toronto, Canada. And the obituary said, never for a day. And by the way, what I'm advising you to do, as you listen to me today, maybe I'll make sense to you, maybe I won't make sense to you. But as you listen, try and see if what I'm saying applies to you personally. Maybe it does, maybe it doesn't. But just try and look at it from that point of view. So this obituary says about this doctor, never for a day did he contemplate giving up the work he so loved at Toronto Sick Children's Hospital. He carried on with his duties throughout his year-long battle with cancer, stopping only a few days before he died. Now, if a friend of yours got diagnosed with cancer and he's going to have radiation and chemotherapy and whatever, are you going to say to him, hey, buddy, go back to work tomorrow and don't take a minute to rest or to look at your stresses or to look after yourself? Just keep going. So this compulsive and rigid identification with duty, role, and responsibility rather than the needs of the self. It's all about what am I going to do in the world, but not about what about me as a person. Is a major risk factor for illness for reasons that I'll explain. I said a rigid identification. Now let's look at that word identification. I know that, again, I don't speak Romanian, but I know that it's very close to Latin. And the word identification comes from the Latin idem, which means the same, and facere, which means to make. So when you identify with something, you make stuff the same as. So when you identify with your job, then you're just your job. And I can relate to that because I used to be a workaholic doctor, completely identified with my role as a doctor, ignoring my own personal needs and that of my family. Why I was like that, I'll tell you later. But that's what I mean by identifying. The next one I'll read you is a woman who died at age 55 also from breast cancer. And this is her husband writing the obituary. And it illustrates the third characteristic of what I consider to be the disease-prone personality. And the husband writes, in her entire life, she never got into a fight with anyone. The worst she could say was phooey or something along those lines. She had no ego. She just blended in with the environment in an unassuming manner. Now, I've been married to my wife for 55 years. And if you're married, maybe like me, sometimes I wish that my wife would blend in with the environment in an unassuming manner. And maybe you wish the same thing, that your partner would just be quiet but you know what? If you want them to be healthy, don't wish that. Because what's being described here is the suppression of anger, healthy anger. And healthy anger is essential for life. Healthy anger. And I'll tell you why. Our brains are wired for different emotions. Not just our brains, but the brains of all mammals. We are wired for love and connection. Why are we wired for love and connection? Because we thought that we can't survive. Why can't we survive? Because the infant is so helpless. So unless the parent is wired for caring for the infant and to love the infant, that infant doesn't survive. And all our lives, we need connection. By the way, I don't know what it's like in Romania, but in much of the Western world, including in North America, there's an epidemic of loneliness. People are more and more isolated, more and more lonely. Now, loneliness itself is a major risk factor for illness. Loneliness is as much of a risk factor for disease as smoking 15 cigarettes a day. And there's an epidemic of loneliness in the Western world. To go back to this obituary, the repression of anger then. So anger is necessary. We're wired for it. Why are we wired for anger? Because it protects us. If somebody enters your space, if you're an animal and somebody enters your space, you better get angry. Ugh, you're in my space, get out. That's the meaning of anger. If you repress your anger, you're not protecting your boundaries. And people are taking advantage of you. And you're stressed all the time. Furthermore, it's been shown in the laboratory that the repression of healthy anger actually disables the immune system. Because you can't separate the mind from the body. So that's the third characteristic of disease-prone people, is the repression of healthy anger. Now, the fourth one is an obituary that you'll find hard to believe, but you have to just trust me that I didn't make it up. This is a doctor who died at age 72 in Ottawa, Canada, of cancer. His name was Sidney. And this is what the obituary said. Sidney and his mother had an incredibly special relationship, a bond that was apparent, in all aspects of their lives until her death. As a married man with young children, Sidney made a point to have dinner with his parents every day as his wife and their 4 kids waited for him at home. He would walk in, greeted by yet another dinner to eat and to enjoy. Never wanting to disappoint either woman in his life, Sidney kept having 2 dinners a day for years until gradual weight gain began to raise suspicions. This man suffered from 2 fatal beliefs. One is he's responsible for other people feel. And nobody's responsible for other people feels. Unless you're a parent, then you're responsible for how your kids feel. Otherwise, you're responsible for what you do, but you're not responsible for how other people feel about it. And the other fatal belief that he had, he was never disappoint anybody. Which means he kept eating 2 dinners a day for years because he didn't want to disappoint either his wife or his mother. So those are the 4 characteristics. Now, at this point, you might be asking yourself, am I, the speaker here, am I blaming people for getting sick? No, I'm not. Because these patterns are not conscious. They're not deliberate. Where do they come from? They come from childhood. And what I'm saying is that a lot of the dynamics, a lot of the processes that make us sick as adults, whether with mental health conditions like depression, anxiety, or others, or physical illnesses, they originate in childhood. Now, these ones that I just described, they all represent a giving up of oneself for the sake of others, or for the sake of being accepted, or for the sake of being liked, or for the sake of being respected, or of not disappointing others. Where does that come from? Well, nobody's born like that. You've never met a one-day-old baby who's worried about disappointing others, you know? No baby lies there at night, oh my God, you know, I'm wet and I'm hungry and I'm lonely, but I'm not to disappoint my parents. They need to sleep, you know? I'm going to shut up. Doesn't happen. We learn it. How do we learn it? Well, we have some needs as children. One need I've already talked about. It's for what we call attachment. Attachment in this case means being close to somebody. And as I said to you, our brains are wired for attachment, for caring, for being close. Why? Because if we're not close to somebody, we don't survive as infants. And we're not close to somebody, we don't look after each other. So we're wired for attachment, and the child has a need to belong, to be accepted, to be loved, to be nurtured, to be held. That's just the need of the child. And you saw what happened in Romania under the terrible Ceausescu regime when abortions were illegal, people were poor, they had children they couldn't afford to look after. These children went to orphanages where there weren't enough staff, and these kids weren't held, they weren't nurtured in the way they needed to be. And so many of them developed stress and mental health problems and physical health problems. So the human infant has a need for attachment, for closeness, not just physical closeness, but also emotional closeness. So that's a need. That's called attachment. But we have another need, which we can call authenticity. And authenticity means from the Greek auto, for self. It means being ourselves, feeling our emotions, being able to express our emotions, and being connected to our emotions. So there's an expression in English, gut feelings. I'm going to ask you guys a question now, and I ask you to raise your hand. If in your life you had the experience of having a strong gut feeling about something and you ignored it, and then you were sorry afterwards, like you ignore your gut feeling, just raise your hand if that happened to you. You see how many people? Well, you know what you just told me? The story of your childhood. Because as I said before, you never met a one-day-old baby that ignores their gut feelings. That's all they have. They don't have intellects. They don't think. They just feel from their guts. So what happens? Now, why are gut feelings important? Because for millions of years, human beings lived out in nature like other animals. How long does any creature in nature survive if they don't listen to their gut feelings? Not very long. So that connection to ourselves is essential for survival in evolutionary terms. So we have these two needs. We have this need for attachment, then we have the need for authenticity. Good. Well, what happens? What happens to a kid who gets the message that if they're authentic and they experience and express their emotions, they won't be acceptable to the parents? Let me give you an example. If you're a parent and you have a 2-year-old, and if you never make your 2-year-old angry, you're probably not doing your job, because the 2-year-old wants a cookie before dinner. And if you're a good parent, you're not going to give them a cookie before dinner. You're going to say, no cookie. Kids say, oh, cookie. And you say, no cookie. Cookie, no cookie. Next thing is they're angry with you. They have a tantrum. Why wouldn't they be? Because a 2-year-old can't tell the difference between what they want and what they need. So they get very frustrated. So they throw a tantrum, they get angry. By the way, many adults also don't know the difference between what they want and what they need. It's not the same. What you want is not necessarily what you need. And what you need is not necessarily what you want. Anyway, the 2-year-old gets angry. Then the parent says, you can't be angry on me. If you're angry, you're going to go to your room and you're going to be by yourself. or you're going to be punished. What message does the child get? If I'm myself, I'll lose the attachment. If I'm authentic, I'll lose my connection. Or let's say in a family, a father is alcoholic and the mother is very stressed. And the child learns that to survive, they have to suppress their own needs in order not to make more hassle and more stress to the family. So the child starts suppressing their own needs in order to take care of the parents' needs. So then what happens is we give up our authenticity for the sake of attachment. And that surrender of authenticity for the sake of being accepted and liked by others becomes a lifelong pattern. And then you get to be 30 years old or 40 years old, and you say to yourself, who the heck am I anyway? And whose life am I leading? And how come I'm not satisfied? Because you're not connected to yourself and you're not leading your own life. It's not your fault. It's how you were programmed as a kid. Now, I'll say a few words about why these patterns lead to illness. It's because what I said before, the mind and the body cannot be separated. And there's a new science. When I say new, I mean about 80 years old, maybe a bit longer. It's called Psychoneuroimmunology. Psycho referring to the psychology of the human mind and our emotional apparatus. Neuro referring to the nervous system. Psychoneuroimmunology referring to the immune system. And to give it its full name, but it's almost impossible to say, psychoneuroimmunoendocrinology. Endocrine refers to the hormones. And what it actually means is that our emotional apparatus in our brains and our immune system and our nervous system and our hormonal apparatus are not separate systems. They're one. They're the same system. So whatever happens emotionally happens physiologically. What happens emotionally happens to your nervous system, happens to your immune system, happens to your hormones, happens to your gut. You can't separate these systems. Medical students, unfortunately, neither in Canada, nor in the United States, nor in the Western world in general, including in Hungary and Romania, are not given this information. And I'm not making this up. There's been tens of thousands of research papers. Now, just to, I don't know how to say this, I'm going to give you a bit of advertising. The material I'm giving you is fully covered in two of my books, both of which have been published in Hungarian and in Romanian. One of them is called When the Body Says No, because my contention is, it looks like this in English, When the Body Says No. And because what I'm saying is, when you don't know how to say no, your body will say it in a form of illness. And that was published about 21 years ago now. In Romania last year, it was one of the best-selling books. And the other book, and the reason I'm giving you this, because if you want more information on how to work with this material, you might want to read these books. You might want to. And the other book, more recent, published just a year and a half ago, is called The Myth of Normal. The Myth of Normal. It's been published again in both Hungarian and in Romanian. And all the studies, or many of the studies that I'm referring to, are referenced in these books. I'm not going to give you the scientific evidence for what I'm talking about. I'm giving you a point of view. If you want to look at the scientific evidence, check out the books if you want to. These are not scientific books, they're for the public, but I do provide all the references. So what I'm saying is that mind and body can't be separated. These patterns of suppressing yourself, they lead to stress, and stress undermines health. If you don't know how to say no, and if you keep being nice to everybody and you're suppressing your own needs, you're stressed all the time. And stress And this is great. There's another Hungarian doctor called János Selye János, or Hans Selye in English, who came to Canada in the 1920s, and he did the work on stress. So the word stress, he's the one that made it up. And he showed in the laboratory that when creatures are stressed, it undermines their immune system, inflames their guts, enlarges their stress glands. So we know that stress now thins your bones, so you get osteoporosis, suppresses your immune system, so you're more likely to get cancer, turns the immune system against you, so you're more likely to get autoimmune disease where the immune system attacks the body, makes you depressed, puts fat on your belly, so you're more likely to get heart disease, changes the functioning of your chromosomes, your genetic apparatus, and many other effects. So basically what I'm saying is these emotional patterns that originated in that childhood dilemma between authenticity and attachment create a lot of stress in your life, and then you get sick. And that's physical illnesses. But let me tell you something interesting. I said that the repression of anger suppresses the immune system. Well, why would that be the case? And that's been shown in the laboratory. Now, why would that be the case? Well, let's look at what anger is. What I said was anger is a healthy defense. It's a boundary defense. It says, you're in my space, get out. I'm talking about healthy anger. There's unhealthy anger, rage. That's something else. Healthy anger is just in the present moment. You're in my space, get out. And once it's done its job, it's gone. That's healthy anger. What's the role of emotions in general? The role of emotions in general is to let in what is nurturing, what is healthy, what is loving, what is welcome, but to keep out what is hostile and what is unwelcome and what is dangerous. That's the role of emotions. Fear, anger, love, basically, it's about letting in what you need and keeping out what you don't need or is bad for you. That's the role of the emotions. Now I'm going to ask you a difficult question. What's the role of the immune system? It's the same thing. The immune system is designed to keep out what is dangerous and toxic, bacteria, viruses, toxins, and to let in what is healthy and nurturing, nutriments, vitamins, healthy bacteria. In other words, the immune system and the hormonal apparatus has the same role. Not only do they have the same role, they're the same system. Naturally, our emotions have an impact on our immunity. Now, I'll say one more thing about physical illness, and then I'll go into mental health conditions. So women are much more likely to get autoimmune disease than men. Autoimmune disease is where the immune system attacks the body that it's supposed to protect. It's like if the Romanian army invaded Romania and started killing Romanians. That's what an autoimmune disease is. Women get 80% of autoimmune disease. Now, why? Big medical mystery. Not to my mind. Because if you look at who suppresses themselves, whose job it is emotionally to look after everybody else, ignoring their own needs, who's not supposed to be angry, who's not supposed to disappoint their partners, it's women. Not genetically, but because of the culture, which is fundamentally a male-dominated culture. And I'm not talking about conscious dynamics here. I'm talking about unconscious things. But that's why women are much more likely to get multiple sclerosis or rheumatoid arthritis, and so on. Now, let me talk to you about mental illness a little bit. I've had 2 mental health diagnoses. I was diagnosed with attention deficit hyperactivity disorder when I was in my 50s. And that's the first book I wrote after I was diagnosed. And the characteristics of ADD or ADHD, attention deficit hyperactivity disorders, tuning out and automatic tuning out. It's hard to keep your mind present and focused. Poor impulse control, so you tend to just act out whatever occurs to you. And sometimes difficulty sitting still. And medicine, when I was diagnosed, said that this is a genetic disease of the brain. And sure enough, 2 of my kids were diagnosed after I was. It looks like it's genetic. But to me, that never made any sense. And I'll tell you why not. Because tuning out is not a disease. What is it? It's a defense. It's a coping mechanism. If I were to stress you right now, make you uncomfortable, you'd have 3 healthy options. One is you could just get up and leave. That's called flight. Number 2, you could fight back. You could say, stop it, don't talk to me like that. That's called fight. But the first thing that you might do, especially if you're a small child, is just ask for help. Mommy, daddy, please protect me. Help me. So help seeking, fight or flight. Those are healthy responses if you're stressed. But what if that wasn't available to you? What if you're a small child and you're very stressed because the environment is stressed? By the way, kids pick up on the stresses of their parents, not because the parents don't love them, but because they can't help it. When the parent is stressed, the child is stressed. That's why kids get asthma when their parents are stressed. Now, if you're a small child and you're stressed and suffering, you can't fight back, you can't ask for help, and you can't escape. What do? You tune out. Your mind goes blank. You go absent-minded. Your mind starts wandering. Then you don't experience the discomfort, the stress, the pain. It's a coping mechanism. It's a defense. But when is this happening? This is happening when the brain is developing. And that's another thing they don't teach in medical schools. But the brain develops not according to a genetic program, but the genes are turned on and off by the environment. So the brain develops based on how the environment acts on the genes. And the most important aspect, I'm quoting from an article from Harvard University 12 years ago, that the most important aspect of the environment that acts on the development of the circuitry and physiology of the brain is the emotional relationship with the parents. So when I was diagnosed, I said, this is not a disease. Because I thought back to my own childhood. And as I told you, I was born in Hungary 80 years ago last month in Budapest. That was 2 months before the Nazis occupied Hungary. Hungary, as you know, was an ally of Germany. But by January 1944, they started to think maybe this is not such a good idea. This war is not going too good. And they were thinking of leaving the alliance, at which point the Germans occupied Hungary. And everywhere else in Eastern Europe, the Jewish population had been wiped out. But in Hungary, there were still 600, 700,000 Jews. Now it was our turn. So the German army marched into Budapest on March the 16th of 1944. I was 2 months of age. The day after the Germans marched into Budapest, my mother called the pediatrician and said, would you please come and see Gabor, because he's crying all the time. And the doctor said, of course I'll come and see him, but I should tell you, all my Jewish babies are crying. Now, what do you think that's all about? When the parents are stressed and afraid, the baby's stressed. Now, I lived my first year like that. with a mother who was terrified, whose husband was in forced labor in Transylvania, actually. And she didn't know if he was dead or alive. Her parents were killed in Auschwitz when I was 5 months of age. I was stressed for that whole year. And when I was 11 months of age, my mother gave me to a stranger because that's the only way she could save my life. So I didn't see her for 5 or 6 weeks. So naturally, I tuned out. There's my attention problem. What about my kids? They grew up in a very peaceful place in Vancouver, British Columbia. No war, no racism. Well, no racism except against the Indigenous population of Canada, which is a whole other story. It's a whole other scandal, actually, but I won't go into it now. But what happened to my kids? Well, I was a very traumatized child, as you can gather. When we marry somebody, here's the bad news, people. When you marry somebody, they're always at the same level of trauma as you're at. So two equally traumatized people get married to each other. And until they heal, they act out their traumas with each other. So our kids, we loved our kids, we did our best, but our kids grew up in a very stressful home environment. So they tune out. So this is how we pass it on. I didn't mean to, but I did. And as I said earlier, I was a workaholic doctor. Now, why was I a workaholic doctor? Because trauma, which means a wound that we suffer in childhood, stays with us until we heal it. So I want to tell you something about trauma. Trauma comes from the Greek word for wounding. It's a wound that hasn't healed yet. So it hurts. So we try to run away from that pain. Now, what was my trauma? And this is very important. Trauma is not what happens to you. Trauma is what happens inside you as a result of what happens to you. So the blow on the head is not the trauma. That's the traumatic event. The trauma is the concussion. My mother gave me to a stranger when I was 11 months of age. That wasn't the trauma. That was the traumatic event. What was the trauma? The wound. What's the wound? How do I interpret as an 11-month-old? Because babies take everything personally. Young children take everything personally. They think it's all about them. My mother did this to save my life, and she did. But how do I interpret it? As an abandonment. Now, who gets abandoned? Somebody who's not lovable. Somebody who is not worthy of existence. That's the wound. And these beliefs are not necessarily conscious. They're very often unconscious. So, if you're not wanted, and if you're not worthy, and you have to justify your existence, one thing you can do is you can go to medical school. Because not they're going to want you all the time. They're going to want you when they're being born, when they're dying, and every crisis in between. You're going to be very important. And every time the beeper goes, I'm wanted, I'm important. It's very addictive. And I'll talk to you about addiction in a minute. So I'm a workaholic doctor. I'm always working, happy when I'm working, and depressed at home. What message do my kids get? The same one that I got. That they're not wanted. That there's something wrong with them. So this is how we pass on our traumas from one generation to the next. So, depression, brain disease, well, physiological. Well, everything is physiological. But the point is that the physiology is inseparable from the psychology. So what is depression? I don't know what Romanian word is, but it comes from, in English, to depress something means to push it down. So when you're driving a car, and if you want the car to stop, you depress the pedal. Sorry, no, that won't make it stop. You depress the brake. You want to go faster, you depress the pedal. What do we get pushed down in? What do we push down in depression? Our feelings, our emotions, our anger. Why do we push them down? Because they weren't acceptable to our parents. So all these mental health conditions and physical health conditions, in my view, most of them have their origin in childhood coping mechanisms. I'll take questions in a moment, but let me just finish with addiction. I'll give you a definition of addiction. And most people think that addiction is about drugs. No, it isn't. I'll give you a definition of addiction, and think about of yourself as I give you this definition. So an addiction is manifested or acted out in any behavior where a person finds temporary relief or pleasure and therefore craves, wants it, but then suffers negative consequences in the long term and can't give it up. So craving pleasure relief in the short term, harm in the long term, inability to give it up. I said any behavior. I didn't say drugs. It could be drugs. It could be cocaine, caffeine, crystal meth, nicotine, heroin, codeine, alcohol, whatever. But it could also be work. And by the way, when I was a workaholic, I behaved just like addicted people do. I couldn't stop it. I lied about it. You know, I used to have a shopping addiction as well. I'd lie to my wife about what I was buying or how much money I was spending. I was a typical addict. And so it could be to work, could be to shopping, could be to eating, could be to sex, to gambling, to pornography, to the internet, to the cell phone, to bulimia, extreme sports, anything. The issue is not the behavior. The issue is your relationship to the behavior. Are you craving it? Does it give you pleasure, relief in the short term, cause harm in the long term? Can you give it up? If no, you got an addiction. So I'm going to ask you guys another question. Ask for a show of hands, okay? I'm not going to ask you what or when. I'm just going to ask you, according to the definition I just gave you, how many of you would agree that sometime or another in your life you did have an addictive pattern? Just raise your hands. Okay, great. Again, no, look around. Most people. That's how common addictions are. Now, if I was there with you and I could hear your answers, I would ask you the next question. I would ask you not what was wrong with the addiction, but what was right about it. What did it give you in the short term? You know what people say? It numbed me. It soothed my stress. It got rid of my emotional pain. It made me feel more alive. It made me feel more connected to other people. It gave me a sense of control. And then I say, well, gee, pain relief, stress relief, sense of control, sense of connection, vitality, are those bad things or good things? They're good things. In other words, the addiction wasn't your problem, wasn't your primary problem, wasn't your first problem. The addiction was your attempt to solve a problem. The problem of what? Stress and emotional pain. So my mantra around addiction is don't ask why the addiction, ask why the pain. Addictions are, no matter what they are, they're just an attempt to escape from pain. They're not a choice. They're not a disease. They're an attempt to solve the problem of human suffering. It's an attempt to solve suffering that creates more suffering, but it starts off as a coping mechanism. And if you want to ask why the pain, it's childhood, trauma. What I don't have time to talk to you about, well, maybe very quickly I do. So when I was working in the downtown east side of Vancouver, talk about pain, I didn't have, over a 12-year period, hundreds of women, I didn't have a single female patient who had not been sexually abused as a child. Not one. And multiple studies have shown the relationship between severe childhood trauma and drug addiction. So childhood trauma, what do we mean by that? We mean traumatic events like physical, sexual, or emotional abuse, a parent dying, a parent being jailed, a parent being an alcoholic, violence in a family, a parent being mentally ill, neglect, a divorce. For each of these factors, the risk of addiction goes up exponentially, according to many studies. And trauma affects how the brain develops, as I already told you. I'm just going to finish by telling you that there's two ways you can wound children. You can wound children by doing bad things to them that shouldn't happen. I just mentioned them. The abuse, the hitting. By the way, I don't know if in Romania it's still fashionable to spank children, but there's been lots of studies that show that spanking kids is just as harmful in the long term as physically abusing them. That's a hard one to explain to parents. If you have questions, I'll answer them. I'm just telling you. And indigenous people who live on the land, they don't hit their kids, by the way. They hold their kids. They also don't let their kids cry by themselves at night. They pick them up. They hold them all the time. So children can be hurt by doing bad things to them, but they can also be hurt not by doing bad things to them, but by not giving them their needs. So I've mentioned some childhood needs. When I say needs, I mean for healthy development. So what are the needs of children? I mentioned attachment, secure, loving connection, being accepted for who you are. That's the first one. The second one is not having to work to make the relationship work. The child shouldn't have to be cute, cuddly, compliant, sweet, smart, pretty, in order to be accepted and loved. And the child shouldn't have to work to make the parents feel better. The child should be able to rest from that work for healthy development. The third need I've already mentioned, authenticity, the freedom to feel all the emotions, joy, love, playfulness, sorrow, grief, fear, anger, and to have that understood and mirrored and validated by the parents. And the fourth need of the human child has to do with evolution. It's free, spontaneous play out in nature, not with cell phones, not with computers, not with screens, out there with other kids of different ages, under the eyes of the adults. That's how we evolved. For millions of years, that's how we lived. So you don't have to hurt kids to wound them, especially sensitive kids. If you don't meet their needs, they're going to be wounded. And those wounds then will be manifested later on in life in physical or mental health conditions, in unhappiness, in relationship problems, in alienation from the self, in a sense of lack of purpose, sense of lack of belonging, loneliness, and so on. So my message is, to sum it all up, it's all one. It's all one. You can't separate the individual from the environment. You can't separate the mind from the body. And today's culture, for reasons I don't have time to go in now, undermines so many of our human needs. That's why we're seeing such a rise in human distress. That's what I have to tell you. Now, if there are questions now, I'll be very happy to answer them. Thank you.
Any questions?
So how are we going to manage this?
Well, we have a mic in the room, so we just want to see people that have questions. We have one there in the back. Just a few seconds, we're getting the mic in the audience.
So in your view, is there such thing as non-addictive or non-pathological drug use?
Godhood? Drug use?
Yeah, not pathological or non-addictive.
Well, you remember what I said, that an addiction has to do with temporary pleasure, relief or craving, harm in the long term, and inability to give it up. So you can use a drug like alcohol non-addictively. You can have a glass of wine twice a week with your dinner. That's not addictive. That's not addictive behavior. You can even use heroin, not addictive. I don't recommend it, but it's possible. So the answer is yes. The issue is not the drug. The issue is your relationship to it. If you're using it to soothe your pain and you're relying on it chronically and you continue to do so despite the harm, that's addiction. If you use something occasionally and it doesn't have that quality to it, I wouldn't call it addictive. No, I think there's a very fine line. And I'd even ask you, why do you want to use drugs? But if you do, in a non-addict, it is possible in a here's a question. Think about it for all of you. Is food addictive or not? Yes or no? You know what the answer is? The answer is yes or no, depending on who's using it for what purpose. You can eat in a non-addictive way. In fact, I think everybody here knows how to eat. I mean, nobody here has never eaten, right? But not everybody here has got a food addiction. But some of you have a food addiction. So again, it's the relationship. Sex doesn't have to be addictive, but it can be. Shopping doesn't have to be addictive, but it can be. So that's how it is.
For the trauma, we have to work for many years. And sometimes you feel like this will never go away. How do you know? When do you know you are completely healed by that trauma?
Yeah. Well, first of all, it is a lot of work and it does take time. And very personally, I can tell you that for a long time, I used to believe that I can help other people, but I can't be helped myself. That used to be my belief. It no longer is. So I'm a personal example of that healing is possible. Now, I don't say that I'm completely healed. I can still show up in ways that are troubling in my relationship with my wife, or, have moods that are distressing, but I'm much quicker now to come out of them. I know how to deal with them much more. So it's it's work, but it's work that's really worth it, because the more you deal with it, the more free you become. Because as long as these unconscious patterns are running your life, you're like a puppet on a string, like Pinocchio. And remember what Pinocchio said after he became a real boy? He said, how foolish I was when I was a puppet. When we were puppets, we're foolish. We think we're free, but we're not. I'm much freer now. By the way, growth is a lifelong process. Emotional growth is a lifelong process. So two things I'll tell you. I just turned 80 years old, and what I say is, I'm glad I'm not as young and stupid as I was when I was 79. So learning is possible. Number one. Number two, how long does it take? As long as you're alive. But that's okay. Now, how do you know? There's a sense of freedom. The decisions that you're making, they're not compulsive. You have options. When something happens, you don't just react. You feel what you feel and you choose your response. So there's a freedom. It's not just like that. So that you're aware of what's happening in your body. There's more peace inside your body. There's less tension. There's more ease. So basically, you know when there's peace in your body and there's a sense of relaxation. And it's not, again, like that. It's a process. But when you look back, you say, well, thank God I'm so much closer to myself than I was 5 years ago. So that's how you know. And don't be discouraged that it takes a long time, because it's a hard word. It's a hard world, I should say. You have to make a living, maybe support your family, be in relationships, and you have to grow at the same time. So don't be hard on yourself. Okay?
Hello, Dr. Maté. You
Hi.
have talked about the immune disease, and I have a question. If my mother had, my grandma, my sisters, how can I stop? Is there a possibility?
Yes. So I could show you some photographs. I'm not going to right now because it's just too much hassle. But I know lots of people who've healed them. They've been told by doctors that you got this disease, you have a disease, we don't know what causes it, or we think it's genetic. There's nothing we can do about it except control the symptoms, and you're going to have it for the rest of your life. And they don't. Whether it's multiple sclerosis or rheumatoid arthritis or scleroderma, they don't have it anymore. Why? Because they dealt with the emotional issues. So, if you have an autoimmune disease, here's the first question I would ask you. You don't have to answer me, but think about it. Where do you not say no? But there's a no that wants to be said on the job or in your personal relationships. Where do you suppress the no because you don't want to hurt somebody else's feelings or you want to be acceptable to them? So you don't say no. Number one. So what's your first name?
Antonella.
Antonella?
Yes.
Okay. Let's say, Antonella, I came to Transylvania and you and I were friends, okay? And I got into town and I phoned you up and I said, hey, Antonella, can you kind of have coffee with me? But you were up all night, maybe with a sick husband or partner or friend or child, and you didn't feel like having coffee. You were just too tired. But you were afraid that if I say no, Gabor won't like me. So you didn't say no. And you came to have coffee with me. What would be the impact on you? How would that affect you? I'm asking you. Well, you'd be tired, wouldn't you?
Yes.
You'd be stressed. You might be resentful. So that little word no that you're not saying has got huge impacts on your body. So the first question I ask people is, where do you not say no? And secondly, what is the impact? And thirdly, why don't you say no? What is your fear? Oh, I'm afraid that Gabor won't like me. Well, you have to decide what's more important, your own health or whether I like you or not. Maybe I won't like you. So what? Then I wasn't your friend anyway. So you have to learn to say no and find out why not. So I highly suggest that you do read this book called When the Body Says No and The Myth of Normal, because it'll explain it all to you. And there's teachings in there about how to work with it. So no, you can stop it by changing your emotional patterns. That's how you can stop it.
Thank you.
Okay, you're welcome. Or at least you can make it much better.
We wanted to say that we don't want to take too much of your time, and because we are on a schedule, would like to thank you for all the wisdom that you shared with us today. Thank you for waking up early in Vancouver and going on Zoom online with us. And thank you for being here and for all your energy. Thank you very much, Dr. Gabor Maté.
Thank you, and goodbye. Thank you.